araw po, and welcome again to the overview of public health in the school setting, which is brought to you by the Department of Education, USAID, RTI International, and the Philippine Society of Public Health Physicians. And now we come to the last lecture on Module 1, which is about infectious disease management and surveillance. Again, I'm Dr. Michael Campued, President of the Philippine Society of Public Health Physicians, will be the lecturer for today. So, although the top causes of mortality in the Philippines are due to non-communicable diseases, there are certain common infectious diseases that are affecting Filipinos. And in particular, within the school setting, there are already identified common infectious diseases that are affecting our Filipino school children. Among these are the common infections like acute diarrhea, acute respiratory tract infection, and of course the tuberculosis, which is affecting every sector of our population. And there are also the seasonal infections such as mumps, chickenpox, and also vector-borne diseases such as dengue, malaria, and leptospirosis. There's also the life-threatening condition, which is tetanus infection, arising from usually improperly cleaned wounds. And of course, skin infections, which are often from staphylococcus infection or streptococcus bacteria, and conjunctivitis, or commonly known as sore eyes or pink eye, Hebd lice, or as we doctors call it, pediculosis capitis, and certain parasitic infections, which are primarily from soil-transmitted helminths such as Ascaris and Trichuris. So essentially, when we see these conditions, we do understand that these conditions have to be planned for because we've already identified a range of conditions that are common among our students. And the roles of school clinics have been defined to more effectively address these issues. So we have to recognize then that the school clinic is a point of care for the management of acute illnesses such as these infectious diseases, and is also a venue for preventive care and health promotion. So here in this slide, we've delineated certain roles for the school clinic for you to understand. So first, it's about school clinics are providing urgent care and first aid for students, teachers, and staff who fall ill or experience injury and distress within the school premises. A second role for the school clinic is coordinating and advising parents or caregivers regarding the necessity for an ill student to be absent from class and ensuring proper health clearance before return to school activities. A third role would be about conducting routine screening, like annual x-rays, physical exam, etc., especially for screening for infectious diseases. A fourth role is the implementation of preventive programs such as immunization and school-based deworming for the student body and the school personnel. A fifth role is about coming up with plans for health communication and the continuity of the school community in facing an outbreak of any infectious disease. And of course, a very important role as well is reporting disease incidence and prevalence to national surveillance systems. So in this slide, we will provide you a very quick discussion of the different surveillance systems within the Philippines. So the Department of Health conducts ongoing disease surveillance for both communicable and non-communicable diseases nationwide. And this is important for early detection, of course, of outbreaks and epidemics, and also to pinpoint possible areas for improvement within health programs at the national and local level. And disease surveillance engages healthcare workers and practitioners on all levels, so from national, regional, provincial, city and municipal, individual barangays, and of course, within facilities like health facilities such as school clinics and hospitals, and also other facilities outside the schools. So these are all participants within disease surveillance. Disease surveillance can generally be either active or passive in nature. So when we talk about active surveillance, it involves the regular collection of data and reporting at set intervals. So regardless of whether the events happen or not, you have to report them, no? And you have to do case finding activities within communities and are also considered part of this surveillance process. Meanwhile, when we talk about passive surveillance, it's relying on the reporting as it comes. No? So as patients come and as the cases are being reported. So from health facilities and laboratories with no real extra effort or exerted to find information. So, but both modalities are integrated within the Philippine Integrated Disease Surveillance and Response System to provide us an understanding of whether there is an outbreak or an epidemic, a change in epidemic patterns within various communities. So, PIDS-R, or the Philippine Integrated Disease Surveillance and Response System, is one of those systems of the Philippines that operates both on national and local levels to gather information about diseases from health facilities and other key points in the community, such as airports, ports, and the media. And the system focuses on three categorization of diseases. So the categories can be those epidemic-prone diseases like dengue, leptospirosis, bacterial meningitis, and of course, right now, what we're experiencing, the COVID-19. There are also those diseases targeted for elimination or eradication that need to be reported, like any detection of polio, measles, rabies, malaria, and other health conditions that are deemed publicly important, like adverse effect on following immunization and any presence of hand, foot, and mouth diseases. Another information system or reporting system that is familiar to a lot of us public health practitioners is the Field Health Service Information System, so or otherwise called as FHSIS. This particular system focuses on the delivery of key population-based services, as well as the prevalence of common communicable and non-communicable diseases. So the FHSIS is accomplished monthly within health facilities and is published annually. But these are also being used by various facilities on a daily basis. And the report contains delivery of key health services such as family planning, maternal health services, care for newborn, child care, including vaccination, and under 5 conditions for children under 5, and also nutrition services for children. So FHSIS is also a means for collecting data on mortality from all causes and morbidity due to specific conditions like infectious diseases that are covered as well by PIDS-R. And when put together, both PIDS-R and FHSIS, we do understand that both of these will provide a high-level overview of the state of health service delivery, and also the response efforts to threats such as infectious diseases. And of course, apart from these, PIDS-R and FHSIS, there are also certain program-specific surveillance systems like the Philippine Malaria Information System, the Integrated Tuberculosis Information System, and for COVID-19, the COVID Kaya. All are working together to build a more robust set of information for us to understand the situation of health within the country. So, after understanding these, it is also important for schools to recognize the reporting actions, that these information are relayed from the specific facilities or care providers and then moved on to larger organizations like regions, and also nationwide reporting systems, and even international reporting systems. So taking, for example, PIDS-R, when PIDS-R identifies the notifiable diseases, so some example of notifiable diseases that have to be reported within 24 hours of detection, like acute, these include acute flaccid paralysis, adverse event following immunization, anthrax, avian influenza, severe acute respiratory syndrome, or otherwise known as SARS, rabies, neonatal tetanus. Also, these are conditions that need to be reported immediately, and there is a need for mandatory reporting. So after these information have been notified, which can be done verbally, by phone, or written through email, this must be followed up and through a properly accomplished PIDS-R form with more details on the case and answering to the case definition that was set by the material or the PIDS-R guidebook. And the report is also submitted to the National Epidemiology Center, which will then transmit it to larger organizations such as the World Health Organization. So we have even a local, a national, and a global picture on the situation of certain notifiable or infectious diseases. And critical to this is the participation of all facilities that can probably and more likely detect these notifiable diseases, including the schools. So, some key lessons from this lecture would be that infectious diseases still remain as a major cause of illness for all age groups in the country, and especially affecting school-age children, and can lead to absenteeism, hospitalization, or even death. So the school clinic is a point of care for the management of acute illnesses within school community, and is also a venue for preventive care, and health promotion. And disease surveillance systems such as the PIDS-R and the FHSIS both provide high-level overview of the state of health service delivery and health of the country, and also the response efforts to threats such as infectious diseases. And based on these, schools have a highly important role because they are participants that can provide information that can be integrated to the country's surveillance and response efforts. And that's it for Lecture 4. Thank you for listening.